Hello, this is Matt Aloisi from Ohio Health Benefits, coming to you from the podcast of Small Business, Big Benefits. Health insurance is confusing. We're going to try to make it less confusing for you by offering you some alternative solutions that are new and innovative in our industry. Today, our guest is Chris Patton. Chris is the Vice President of Channel Sales at Sidecar Health. Sidecar Health is an innovative, bold solution to traditional health insurance, coming about by one of the founders' ridiculous experience with MRI pricing. They offer a transparent and cash price model so you actually know what a medical procedure costs. So without any further ado, welcome Chris to the podcast, and maybe start with our first question. What is Sidecar Health?
Matt, thanks for the time. I appreciate the opportunity to help get this message out. So Sidecar Health is really, it's health insurance 2.0 in the United States. It's the result of our co-founders, Patrick Quigley and Veronica Ostiense. They basically, identified a problem with access to care and the price of care, and decided to jump in and try to fix it. So in the shortest version of what we are is we are a cash model, right? So we empower our members with the ability to understand how much they have at their discretion to spend for benefits in the health insurance space. We give them the ability to pay for it, and we actually give them the opportunity to share in the savings if they're good consumers.
Chris, why should an employer implement Sidecar Health as their benefit plan?
Yeah, that's a big question. I think the short answer, there's a two-part answer to the question. One is cost. We've seen health insurance premiums on the employer side raising, really outpacing inflation 2-to-1 for a decade. So we're able to bring a much more affordable and stable priced option. And I think the second piece is, at the heart of what we do, we're an employee benefit. And I think we bring more benefit to the table for employees in that, we're able to allow access. Just the mechanisms of the plan allow people to get more health insurance for less dollars and less cost share.
One sticky point with a lot of employees is networks and how convoluted and difficult they are to navigate. How are your provider networks determined?
Great question. So provider networks, historically have been a really big lever for the payor to pull, right? The insurance companies slice and dice access to hospitals and doctors, trying to control that premium cost. And as a result, employees are having to navigate a maze, right? So it's moving from one insurer to another at open enrollment generally has a pretty disruptive effect on employees. And so our model is based on a no network model. And so in essence, with our cash pay model, in that our member has an amount that they can spend on a provider engagement. Let's say it's a level 3 office visit with a cardiologist. They have a set amount, and where they go is not determined by a network. So in essence, there is no network. Or conversely, our network consists of any provider that'll take cash payment.
Excellent. Is there a prescription drug coverage that's available with your plan, Chris?
There is. And again, that's another lever that insurers have used to try to control costs. And we've seen that manifest in a couple different ways, right? So the formulary or the list of drugs that are available to an employee in a commercial plan will have certain drugs that are not on the list. Or if they're on the list, there may be certain hoops that have to be jumped through to get there. So for example, step therapy. If I need a drug that's deemed expensive or on a higher end of the cost spectrum, my physician prescribes it. In traditional insurance, oftentimes as a member, I'll have to do other things to get there. We call it step therapy, right? I'm going to work through other drugs that are less costly to get to the more expensive one, hopefully, ultimately. Here at Sidecar Health, we have a drug benefit, and some of our plans, to give you an example, have no cost share to the member for access to prescription drugs. So you can have a plan from us that has a zero copay, that will give you access for no cost share to generic drugs. So, lots and lots of folks, as it turns out, are on Lipitor, right? So a generic version of that, you can access that. We'll show you where to get it. We'll show you how much benefit you have to spend on it. And then on the higher end of the spectrum, there's drugs like Stelara, Humira, some of these specialty drugs that are, thousands of dollars of prescription or even tens of thousands of dollars of prescription. They are available, and same plan, same member accessing a specialty drug is going to have the same cost share of zero.
Getting back to something you mentioned in a prior question, this benefit level, how is that determined?
So our benefit level, it's kind of it's the key to the whole thing. And so we go about setting our benefits in a way that's materially different, I think, than anything I've seen. I'm 30 years in the business, and I've had worked for a couple of large national carriers. The model at Sidecar Health is very different. And the short story on how we set our benefits is we actually survey the marketplace and go after and solicit providers, hospitals, pharmacies for their cash pricing. So whereas our competitors, a lot of times it's just an arbitrary reference to Medicare. It's a percentage of Medicare. I mean, it's blanketed over large areas. We'll go in at a very granular level, geographically, at a zip code level in a lot of cases, and we'll survey physicians, hospitals, labs, and we'll actually understand what that cash price is, and we'll set our benefit right in the middle. So our goal is to be at the 50th percentile mark, meaning that if you need to see an orthopedist, 50% of the orthopedists will charge more, 50% will charge less in your neighborhood.
Adding to that, for an example, benefit amount for a cardiology visit shows up in my zip code of 44278 as a $200 visit. Okay. Your benefit amount showing up on the app says $250. What's that difference, and how is that $50 difference accounted for? What does that go back to the employer? Does it go back to the employee? Does it just go back to Sidecar Health? Maybe talk for a little bit the operational end of the difference between benefit and
that's a great question, and it's really, I think, it's the third leg of the stool. So if the first leg is letting our members understand, of 170,000 procedures that they can have, prescription drugs filled, et cetera, giving them the ability to pay for those procedures, right? The third piece is exactly this. So if a consumer, a Sidecar Health member, is a good consumer and they understand that they have a $200 benefit for a cardiologist visit, and their cardiologist charges them $150 or something less than that $200, our members actually share in the savings. So that credit, January 1st and forward, we'll actually split that with the member. So in that case, $150 visit with the $200 benefit, that member is going to get a $25, what we call a benefit credit, added to their member portal. And with that, they can do a couple things. So if in the future they see a provider that charges more than the benefit, they can use that credit. They can apply it towards their deductible if their deductible hasn't been satisfied, or ultimately at the end of the year, if there is an amount of credit in that bucket, we'll actually cut a check to the employer for distribution to the employee. So you'll actually get cash for being a good consumer, and that's really it's the mechanism that drives everything, right? We want our members to have incentive to make good decisions and engage in the process,
making us smarter consumers of our healthcare. But we know what the cost is, so we can be smarter consumers.
Exactly.
So let's flip this over to the employer side for a minute. How would premiums be determined for a group plan such as Sidecar Health?
Sure. So we are a fully insured plan. So we're a fully insured large group plan, meaning 51 or more employees. And these are all employees, whether they're eligible or not. And being fully insured, ACA compliant, we have some levers that we can pull. So we're actually going to underwrite the risk. We want to look at the group. We're probably on the lighter touch side from an underwriting perspective on the front end. In that group's under 100, we're really looking at just a member level census. So we want to get a feel for who's in the group. We have some back end mechanisms that use some modeling that go out and capture information based on those folks. But we'll actually come up with a rate that's based on what we see as the risk associated with that group, right? So it's the basics, demographics, it's the gender, the age, the zip code. But then it'll dig in and it'll look for habits. So it'll pull, RX utilization data and some other things. It's really accurate. It's very fast. We're able to get quotes out pretty rapidly. And then larger groups, so over 100, when they do have reporting, we ask to look at it. So we take into consideration their large claimant report. We take into consideration their current premium, their renewal premium. So we're, more traditional in that respect, is that we're looking at, things that most of our competitors are also looking at to determine that rate.
Turning it over now to the providers and the facilities. How is the reimbursement determined for those entities? Because that's something we hear a lot of. Oh, well, our doctors aren't making money. Our facilities are near bankruptcy because we can't keep the lights on. So how do you guys determine the compensation for providers and facilities?
So two-part answer. One, we determine the benefit amount right at the employee level. So the employee knows how much they have to spend. But when it comes to the provider and what they charge, it's 100% at the discretion of the provider. So they're telling our member what they're charging for whatever services they're providing, and that can be, a basic office visit all the way up to outpatient surgery. And so when our member presents themselves, they're presenting themselves as a prompt pay or a cash pay patient. And they have a Sidecar Health Visa card that's provided by us, it's funded by us, and that card is used to pay the provider at time of service. So whatever the provider determines that they're going to charge for that office visit or that procedure, our member is going to pay them 100% of that charge at the time of service. So the provider response to that is it's been spectacular, right? Because they're made whole. They're not having to submit a bill or submit a claim to a provider and wait for reimbursement, and that could be 3 months, 4 months, 5 months, depending on the relationship. But they know for certain what it is that they're going to get paid, and they know for certain that they're reimbursed in its entirety at the time of service. And as a result, what happens is we see these providers are willing to offer pretty significant discounts, right? Because they're not at risk if they have to. Let's say it's an outpatient procedure that's subject to a deductible. A lot of providers, they're responsible for collecting the deductible from the member. And in an age where, average deductible nationally is over $2,000, these providers, they have AR hanging out there that it's very difficult to collect oftentimes, right? So we completely eliminate that problem. The responsibility, the cost share responsibility, if it's more than the benefit amount, or if there's a deductible involved, it's between the member and Sidecar Health. So we take the provider out of the collections business.
Which I'm sure they absolutely love. So being that Sidecar Health is relatively new, I know recently there was some wonderful news that Koch Disruptive Technologies made a significant investment in Sidecar Health. Maybe talk for a minute about the financial stability of Sidecar Health. I know you're going to be going into a new market in Florida in October, but just because you're a newer entity, people may want to understand how financially sound Sidecar Health is.
Yeah, it's certainly a conversation that comes up from time to time. So we were privately owned. We're a private equity-backed company. We've been around since the mid-teens. So, we just closed our Series D round of funding. It was a $165 million round, which was interesting. The private equity markets have been pretty tight as of late. So there haven't been a lot of raises in that amount category. So we were happy about that. Obviously having the cash to continue doing what we're doing and expand is important. But, I think that the headline there was really who leaned in and wanted to be part of this. So as, Koch Disruptive Technologies, they're looking for, players like us in industry like ours that they see as something that's going to, present a material change in the sector. So they identified what we were doing in our space and leaned in pretty hard. And not only do they, back us financially, but we're introducing Sidecar Health, the product, to their members in the state of Georgia. So they've got 13,000 or so members, and we're going to be riding alongside of their existing plan as an option for them. So not only were they excited about what we're doing outside of their company, but inside as well. They see this as a really good fit for their employees.
Congratulations, Chris.
Thank you.
So in a comparison, if we were to look at a traditional $5,000 deductible plan versus Sidecar Health plan, what makes Sidecar Health more advantageous for that employer to implement your benefit versus a traditional medical plan?
Yeah, I think that, the benefit designs, when we look side by side, because we've trained our clients to look at deductible. We've trained the members to look at deductible. That's kind of the gold standard of how you look at a plan to plan. And for us, what we find is actually really challenging for us, because when we compare deductible to deductible, it's really not apples to apples, because in our plans are very simple. So the plan has a deductible. The out-of-pocket maximum always matches the deductible. And then there's either first dollar coverage or there isn't. So it can be, let's just use your $5,000 deductible example. It may just be a straight $5,000 deductible where you've got to spend that much and hit it, and then it pays at 100%. Or it has one of our copay plans where it's a zero copay for provider encounters and prescription drugs. In any event, if I was to take, the zero plan, let's say, and compare it to a traditional $5,000 plan, the traditional plans are going to have copays, coinsurance, and likely an out-of-pocket max that's the standard is double the deductible. So when I show my $5,000 plan against traditional plan, it's a much richer plan. And by that, to use an example, let's say that it's the actuarial value is 10% richer, which is usually what we see. And that's a standard by which we measure plans. It takes into consideration all the elements, the co-pays, the co-insurance, the cost share of the employee. So it averages out and it projects what the employee would spend versus what the insurer would spend. So if we're 10% richer from an actuarial value comparing deductible, that equates to 45% less cost share at the employee level in an average plan year. Right, so it's a much richer plan, and generally what we find is that plan, even deductible being richer from an AV value, is generally double digits less expensive from a premium perspective. So it's generally speaking between 12 and 20% less expensive on a monthly basis to the employer for our plan.
And what you just described earlier, the operation of the plan is so much easier to navigate because you don't have networks. So just if you put that equation into it just on its side, that's amazing, because the apples to apples comparison is a richer plan, but they're not having to navigate networks and having to figure out, right, can I go to Dr. Z versus Dr. A? I mean, so that, to me, I would think a lot of employees and employers would just absolutely love.
It's a blessing and a curse. And I think, along the lines of, the ease of use part of it, not having to navigate a network, there's a couple other big pieces, and it kind of falls into the category of, how payers have controlled costs, right? And if you look at, probably the more vexing mechanisms from a member's perspective, prior authorization is a big one, right? So most traditional carriers, our competitors in the market space, if you use, it's a knee replacement, for example. If I am diagnosed as needing a knee replacement, that's going to require my insurer to approve that procedure, right? Because it's expensive. And so, generally what we see with these more complicated procedures, that the insurers want to get involved and try some other things, right? And as an example, with that knee procedure, they may want to require that I get a cortisone shot, go through sessions of physical therapy, right? And then I get the approval to do the knee. So one of the kind of our North Star at Sidecar Health, we don't want to be in the middle between the member and their provider, right? So no network to navigate. Yep, that's great. But the part where it really starts to perform and where people really start to realize the benefit is that we're not engaged in managing our care, right? So you don't have to come to Sidecar Health and ask if you have approval for a knee, right? You need to come to Sidecar Health and understand how much you have to spend on that knee, right? And then you need to understand how much your provider is going to charge you for that and make a good decision. And we see that, not only with procedures, but also with prescription drugs we talked about a little bit, right? There's no barriers to care. We don't insert ourselves in the process. So, from my perspective, having been in the business for, quite a while, it's refreshing, right? It really takes the payer and puts us where we belong, right? In insuring against risk, and it allows the physician to practice medicine, the member to benefit from it.
What a concept.
Yeah.
A couple of last questions. So what types of percentage of renewal increases are you guys typically seeing with your groups that are part of Sidecar Health?
Yeah, so that's really exciting. So we've kept a close eye, and as a sales team, what was near and dear to us was to be able to go to our distribution partners with a competitive rate, right? That gets everybody's attention right out of the gate. But it's not unusual for our competitors to go into market and have a competitive rate. What we've learned from that is generally the back end of it, it's gonna produce a pretty significant renewal increase, right? It's a first year deal. But because we have some structural differences in how our plan works, our first year of renewals in the Ohio market, we saw an average of sub 4% renewal. So, and this is in a market where the groups that were coming to us were, they were presenting to us 20%, 25, 30% renewals, right? So they were in a bad way. They needed a cost control mechanism. We represented that on the front end, and they had to take our word for it that it was going to be stable on the back end. But we're really excited. The first year was just under 4% on average across the book of business, and it's looking like it's right around 4.1 in the second year. So, it's been a breath of fresh air for a lot of these groups that have, been on the renewal increase roller coaster to get into a plan that's affordable, and stable.
Awesome. So, as one of our partners here recently, working with you and Brittany, I'm excited about the product as a broker. I've been looking for something to share with my employers that fit this category, and I love the transparency. I love the cash-based model. But like anything else, when you're trying to go out and guide employers and employees on something that's innovative and bold, what are the cons? I mean, obviously there's a lot of pluses to this, but I would imagine maybe one of the cons could be that it makes the consumer do a little bit more homework and a little more legwork. But maybe what am I missing that might come up in these discussions?
Yeah, no, Matt, I think you hit the nail on the head. What we find is that the resistance to the model is just that, right? Because we, as an industry, in consumers of health insurance in the industry, as well as a distributor and a carrier, right? We've never really asked the members to be a consumer, and it's elegant in its simplicity. I mean, we're a consumer of everything else in our lives: automobiles, cell phones, you name it. So we do see it's a twist, and it's a shift in thinking for our members that we have to guide them through, because they're just not used to, having those kinds of controls. And it's a conversation that's interesting. There's a reluctance that we have to coach them through, in that, calling somebody, calling your doctor and asking them how much they charge to see you. It's not something we're used to doing. It's more, are you in the network, understanding our copay when we go there, but really taking control, having a budget, that's the great part. But then, where we see people when we really need to work with them is, hey, you got to find out how much they charge. You got to understand how much that knee replacement's actually going to cost, right? And you have to budget for it. So it's interesting. We run through our sentiment scores on a regular basis, and what we find is that our highest ratings across the board come from people that are heavy utilizers, right? So they've been diagnosed, or they had a procedure, or they're on medications, and they've had to lean in, use the Sidecar Health Visa card, understand their benefits, right? And when they do that, they realize that the benefits that they have available to them, and the barriers that have been removed to care, are unlike anything they've ever seen. Where we see the most amount of abrasion, where we see the lower scores, is folks that have never swiped that card, right? So the idea of having to engage and understand and ask their physicians for pricing, right? And go to one pharmacy over another because, it's 200% more expensive at one than the other. They're the ones that are least likely to give us praise. So, it's interesting. It's unlike any other product, where the folks that are really, really using it are the biggest fans.
Awesome. Chris, that wraps up the questions I have. Is there any other final highlights you want to leave us with before we close out this appearance?
No, I appreciate the opportunity, Matt. I think, we are 100% dependent on our broker distribution. I think that the broker relationship with a client is the way that this industry works. I don't see anything ever changing in that. the trusted advisor role is critically important. And I think that, it's going to be, as we help you be successful, I think you're going to help us be successful in bringing this to clients and helping them understand, right? There's a new way to do this. So thank you. Thank you for the effort.
Oh, you're welcome, Chris. Thank you for what you guys are doing at Sidecar Health. As I said before, as a broker and an advisor, I'm excited to have this product at our disposal to use for our clients and continued success.
Fantastic. Well, thank you again for the time.
You're welcome.